The biggest question that most of my patients ask is knee replacement a successful surgery? A lot of my friends who I talk to say it is a failure of a surgery, that I will not be able to walk again. So I'm very worried whether after the surgery, if it becomes a failure and if I'm not able to walk, then what happens? Hi, I'm Dr. Kunal Patel with 14 years of experience in orthopedic surgery. Today I'm going to solve a few of your questions and make you understand what knee replacement surgery is all about. A lot of you may be thinking about knee replacement surgery. What is knee replacement surgery? Is knee replacement surgery actually changing of the actual knee, or what is the artificial knee that you're putting in, and what does the artificial knee combine of, and how long does this artificial knee stay? So one of the things is, basically, let me start with what knee replacement and what do we do in knee replacement surgery. Basically, we do knee replacement surgery for a patient who is having severe arthritis. Arthritis means wear and tear of the knee joint, where the knee, which is supposed to be straight, is now bent inside or in the outwards. So what we need to do now is we need to remove the bad cartilage and replace it with an artificial knee joint. This artificial knee joint is made up of titanium and alloy of metals along with a polyethylene insert. So this is the metal. This is absolutely MRI compatible, and you can do an MRI after your knee replacement surgery. So during the surgery, this implant is what is put inside after cutting off the damaged cartilage. This is what the surgery is actually about, and it is done for patients with severe arthritis, grade 4 arthritis, where they have a deformity and they are not able to walk, and they have a problem walking and doing their activities of daily living. So when my knee is so bad and I'm not able to walk because of my knee problem, and when my knee is bent, I think of most of the patients, they think of what is the options that I have. The first option that I think of is whether I can take some supplements, or whether I can take some tablets, medication, whether I can do yoga, maybe I can go to a physiotherapist, maybe if that doesn't work, I can do an injection. Yes, all these options you can do, but they're all to be done at different stages of arthritis, when your knee is not too bad and when you're able to perform most of your activities in the early stages of the knee problem, in the early stages of the knee arthritis. All these things can be done. I'm a promoter of exercise, I'm a promoter of yoga, I'm a promoter of all these things, but that can be done up to a certain stage, and it must be done up to a certain stage. This also helps in increasing the lifespan of your knee joint and postponing the surgery by doing all these things in the early stage, which must be done. But what happens is, in the later stages, when the knee is bent and when your activities of daily living are compromised, then the only option that we are left with is knee surgery. Now, most of you think, like I was saying, that knee surgery is a serious surgery and that it may cause me not to walk, and it may also disable me or cripple me for my life. I'll give you a fact. There are actually approximately around 7 lakh knee replacement surgeries happening in India every year, and they are increasingly proportionately every year. So if this surgery was not a successful surgery, I'm sure we would not be doing such high numbers of knee replacement surgery. And hence, this shows one of the biggest things, that it does well. Most people do well. The success rate of knee replacement is approximately 90%. Yes, definitely 10% of the patients don't do well, but there are certain reasons for them, and to classify them as not doing well. One of the most important things that I personally feel that we need to talk to the patient, all of you need to get counseled by your doctor about what knee replacement surgery is and what you can expect from a knee replacement surgery. Knee replacement surgery has a success rate of 90%, which is a very, very good success rate. The 10% failure rate that we have in knee replacement surgery, in that the 5% is serious failure, where you have surgical problems, surgical errors. The other 5% of the patients are surgery done right, but they are not satisfied. Why are they not satisfied? What it is that the counseling is not done well, and hence they're not able to achieve, or there is a gap between what they have thought the surgery will give them versus what the surgery has actually given them. And 5 to 10% failure rate in any surgery is very normal, and that is what happens with any surgery. So knee replacement per se is not a surgery which is a failure of a surgery or which is not a successful surgery. It is a surgery which is like any other surgery, having the same amount of complications that any other surgery have, and not more than any other surgery. Now the question is, should you get the surgery done or should you not get the surgery done? The decision to get the surgery done or not has to be decided by various factors. The decision to get the surgery done has to be decided once you go and meet a doctor. First thing is, you yourself need to know what your daily activities are, whether you're hampered with your daily activities, do you have pain with your daily activities. Second thing is that you need to see the doctor, get your x-rays done. You need to be counseled by the doctor in case you need to undergo the surgery the right way and what to expect out of the surgery. Once all this is done, and in case if you fall in the category of doing knee replacement surgery, then and only then should you get the knee surgery done, and then it is definitely a successful surgery, and you will fall in the 90% of the category where the knee replacement, you feel happy and you feel happy that the knee replacement is done. Now the point here that I would like to make is, in case in such a stage you don't decide not to do the surgery and you decide to go on with the joint that you have and walk, and eventually what is going to happen is that you're going to stop walking and you're going to be pretty much bedridden just from your in-house bound, just going within your house from the sofa to the bed and probably just to the bathroom. Now if we look at the complications also, it is better to have the surgery, and the maximum problem that you have with the surgery is that you have a lingering pain that is always there post-surgery for the rest of your life. But at least it keeps you mobile and it allows you to go outside the house and it allows you to lead a near normal life as possible. Now, with this new normal life that you have, you can have many questions. How long will this recovery take? What will be my treatment post the knee replacement surgery? Now, typically post a knee replacement surgery, what I advise all my patients is that for the first 1 month, try to walk with a walker. Although you can walk much earlier without the walker, walk with a walker and do your strengthening exercises, which include climbing stairs and walking and doing your regular activity. So the first 1 month has the maximum rehab that you have to do, the maximum pain that you have, the post knee replacement surgery. 60% of that is solved in the first 1 month. In the 60%, the first 1 week, 30% of your problem is solved, and the second week is the rest of the problem that gets solved. Out of the next 40% of the pain that is left, in the second month, in most patients, 30% of the problem is solved. And in the third month, totally 95% of your problem is solved. Now, the only rest of it is the 5% of your problem where it in terms of pain, in terms of walking, that is left, is the pain is all gone by 6 months, and usually most of the patients, 90% of the patients are able to walk at least 5 to 6 kilometers at the end of 6 months, and much more at the end of 1 year. At the end of 3 months, they can go into a mall, they can go to shopping, they can go for a holiday, and they can do most of the things that they like to do. And when it comes to going back to work, your regular work where it involves sitting or maybe walking a little bit, you can do it 45 days post knee replacement surgery. Now that we have spoken about the recovery period, I will throw a little bit of light into what diet you should do, maybe, and the precautions. So the diet, what I personally feel is that there is multiple diets. If you're obese, then you need to visit a dietitian and then get on a proper diet so your BMI is under control. But what I always suggest every obese person is try and be at the BMI of at least 30. 28 to 30 is a good BMI because this gives more longevity to your knee joint. The knee joint lasts longer. The actual amount that a knee joint lasts is approximately 25 years. And by keeping your weight in control, keeping your muscles strong, it gives a longer life. And hence, that is better to do that. The precautions that I should take. one of the precautions that I suggest people to take is I would suggest them not to sit on the floor. The reason for not sitting on the floor is that the wear and tear that you have and the maximum load that happens on the knee joint after a knee replacement surgery and causes more and more wear, and it reduces the lifespan of the knee replacement surgery. Hence, sitting down on the floor is avoided. The rest, anything you can do, I would suggest you to do cycling. I would suggest you to do static cycling or cycling on the road. And one thing that you may not be able to do is sporting activities like playing football or cricket, or any sporting activities is something that you may not be able to do. But keep your muscles strong. Certain gym exercises, keeping your quadriceps strong and hence hamstring strong, must be continued throughout your life. And one thing that I always tell every patient of mine is that we are doing this surgery so that you remain active. That is the goal of the surgery, and 90% of the satisfied patients, what I tell them is that we are doing this surgery so that you feel happy and you're mobile all your life, so that till the day you live happily and you live with a mobile joint. And knee joint is one of the most important joints for you to walk, and hence if the knee joint is right, you will be able to walk all your life and you will be mobile all your life, which is the most important thing. Even psychologically, it keeps you happy, it keeps you going. And hence I always recommend this surgery to the people who have a bad arthritic joint.